Clearly, it's important to take stock of the problem and identify where the needs are.
And we were staggered to find that common mental disorders had a prevalence of around 45% in the under 25s, compared with nearly 16% in the over 24s.
In high-income countries, I think another thing that's important, maternal suicide is the leading cause of maternal mortality.
Actually, social factors are so important even when one's considering biological risk factors.
Several myths about maternal mental health have contributed to this state of affairs.
Prevention is so extremely important.
One of the most important things that I think we need to talk about is the conflicting messages that pregnant women get about whether or not they should be taking their psychiatric medications during pregnancy.
Let's not forget the stigma that goes with maternal mental health.
We know very little about clinical trials about it. We should know about it. We know of the deleterious effect of stopping these medications during pregnancy.
There's also a lack of research in pregnant women in general, but particularly in pregnant women with psychiatric disorders.
We don't have high quality safety data.
There's also a gender issue there, which I'm sure you're all aware of, that often many drugs are not tested on women at all.
Are we ever going to break that taboo, or are people just scared to touch pregnant patients as clinical subjects?
We treat all kinds of medical conditions in pregnancy, from asthma to cancer. And there's no question that we need to treat those conditions. And psychiatric disorders clearly have adverse impact, not only on the mother, but the children.
At least 20 million mothers will have depression each year. Most of them will live in low and middle income countries.
We have to talk about COVID, a biological risk factor in itself, and it's the increasing evidence for an increase in perinatal mental health problems, and I think importantly, domestic violence and abuse and other exacerbation of inequalities.
The exposures to stressors during pregnancy, we just talked, for instance, about the COVID-19, has been recurrently associated with the onset of neurological conditions in the offspring.
Young mothers are particularly at risk. They're being more isolated. Their mothers and mother-in-laws are not being able to come and support them in those early days.
And then we mustn't forget the effect of traumatic birth.
Not only mothers, but fathers and other caregivers are also at risk of stress and anxiety and other mental health conditions during the perinatal period, and this can affect their health as well as relationships.
A one-size-fits-all strategy does not work, and this is where I believe midwives come in.
The additional cost for scaling up support for perinatal depression in existing health systems is only about $0.1 to $0.2 US per person per year.
We're actually doing a grave disservice to pregnant women and their developing children, as well as families and communities in general, by not including pregnant women in research.
Midwives, as part of a disciplinary team, have the potential to play a key role in both preventing and identifying the first signs of mental health issues in pregnant women and new mums.
A lot still has to be done in the field of drugs for psychiatric disorders. We really badly need them, and unfortunately not only during pregnancy.